All right, so let's go ahead and get this show on the road. Um, for those who don't know me, starting out like Tracy does, my name is Zaire. I am a registered nurse, a herbalist, perinatal specialist, womb wellness specialist, uh, midwife, and then there's like a whole lot of other things that go along with that. But those are pretty much what I do, what I specialize in, and how I keep myself happy every day. Um, One of the things that has come up is, once you're pregnant, there's nothing you can take. You know what I'm saying? Like, there's absolutely nothing you can take. Everything is a problem. Everything has a side effect. And usually, what ends up happening is that moms end up going through their entire pregnancy uh, having to suffer certain things. The thing about it is that there are herbs that can be taken prior to conception, during pregnancy, in labor, and then postpartum to help with all the transitions. And so that's what I'm going to talk about today. We're going to just, you know, go over some herbs, some known, some maybe unknown, that are safe. And when I say that they are safe, for those who are very left brained, I need to see a double blind study that that was tracked over a 10-year time period in 5 different countries. The herbs that I'm going to talk about today have that kind of background. So if you have access to like PubMed or any of the websites that publish studies, you'll be able to find all the documents, not all the results from those studies regarding these herbs. Okay, so let's go ahead and get it cracking. So just real quick, I don't mind taking questions during the conversation. But what happens is that I'm going to go to full screen, so I'm not going to see your questions right away. So just give me a minute, and when I come back to this screen to look at the questions, okay? All right. So share. So from beginning, start. There you go. All right. So that's me. And that is the beauty. I love this picture. Mother Earth in all of her essence, her babies, the plants, and how we are all literally just one. I tell everybody that we are, as humans, we are plants with just complicated emotions. All right. So for thousands of years around the world, it has been considered vitally important that midwives be competent in the use of herbs, not just in labor and delivery, but for the pre and postpartum care as well. Herbs are people's medicine. They've been since the beginning of time. Um, in and in midwifery, we use herbs for everything, literally from gestation, birth, nursing. You broke your leg, you can't get pregnant, you're getting pregnant too much, it doesn't matter. And the cool thing about herbs is that the stuff that we use for pregnancy specifically, or for pregnancy, labor, and postpartum, it's not a whole lot that you have to know. Literally, everything that you need to know about herbs regarding the use of it during pregnancy can be learned within a day or two, a weekend. Now, getting deeper into it and going to other uh, processes could be a little bit more of a lengthier process, but for the most part, you can learn it all in a couple of hours. Um, so again, the use of herbs is especially important during pregnancy and lactation to help increase the nutrition of the breast milk, increase the nutrition of pregnancy, as well as when it's time to wean the baby off. Okay. Um, Even more importantly, the nutrition. And that's one of the big things that we have to look at, and we're going to talk about today, is the use of nutrition during pregnancy. Now, just a little history of plant medicine. It's been around since the beginning of time, literally. There's a large amount of archaeological evidence that exists, which indicates that humans have been using medicine for over 60,000 years. The earliest known medicinal herb list, like written down list, is the Sheng Fin Sao or the Shin Non Ping Jiao Jing, which is out of traditional Chinese herbal medicine. But even further than that, the Ebers Papers, the Egyptian Book of the Dead, those are even older texts, and in there they even talk about the use of herbs. Okay. There are a few traditions that have continued the use of herbs throughout history, and that's been primarily midwifery. So although all of us are birth workers at different levels, understand this is the foundation of midwifery, okay? Supporting women, supporting families, okay? And literally the word midwife, it actually breaks down to with women. And birth work has always been a thing of women to women care in every indigenous culture around the world. So let's look at preconception, okay? Preconception plants and botanical medicines have been used for women's health and healing for centuries, including pregnancy support, birth, breastfeeding, different types of healing and balancing out imbalances or let's say uncomfortable processes that happen pre and during. Okay, so we're going to talk about preconception right now. And just real quick, what processes do you think in preconception herbs could be a great deal with, could help?
State the question again.
In a preconception prior to birth, what do you think we can do to get the body ready for birth? What are some of the things that you think we could do?
Red raspberry and red clover.
Okay. What else?
I should know.
Dandelion for detoxing.
Okay.
Nettle.
Okay.
Calcium.
Okay.
Iron-rich food.
Okay, good.
Vitex.
Okay, so y'all want to go ahead and do this lecture because y'all got all the herbs. So y'all.
Red raspberry.
Okay.
Folate.
Okay.
Peppermint.
Okay. Well, before we go continuing on, let's look at it like this. So without knowing the deep, intimate nature of all the herbs that you guys just listed, why do you think it's important to prepare for pregnancy?
You have to come to it with a whole nourished body, fully mineralized and ready and strong to prepare the internal environment before you even conceive, and that's both partners.
Got you. Correct. Exactly.
Is important.
What'd you say?
I said detoxing is important, you know, detoxifying your body, making sure it's healthy, like the lady said before.
Exactly.
I feel like pregnancy is something that you shouldn't prepare for once you find out you're pregnant. It's something that you should start preparing for way before conception.
Exactly. It's really important to do that. A lot of women, you know, we fall in love and we wake up one morning, it's like, hey, I want a baby. Or, you know, we have one good night with way too much tequila and then we wake up pregnant. We're not prepared for it, you know, not mentally prepared for it and emotionally. And so what happens is that prior to that ends up throwing our bodies out of balance. You know what I'm saying? Like we come into a pregnancy already, like Sister Leonie said, you know, you got to detox, you know what I'm saying? So some of us have really horrible diets where, you know, we have McDonald's on Monday, Chick-fil-A on Tuesday, and Red Lobster on Wednesday. That's not necessarily the best situation. And then we have other processes that may have happened where we've had PCOS, endometriosis, we may have had chronic infections or whatever. And the thing about all of that is that it ends up making our womb very toxic. Okay, so think of your womb as a garden. Okay, so for y'all that don't know me, I'm a horrid gardener. I love gardening. It's my everything. Next to babies. And one thing that we always have to do is prepare our garden. You know what I'm saying? We have to get the soil ready. We have to get the nutrients, the amendments. We have to get it ready so that we can plant the vegetables or the herbs or whatever it is that we want to grow and have a good harvest. Our womb is the exact same thing, the exact same way. So, as you young ladies said, that there are certain things that we can do, certain herbs for sure that we can do to get our womb ready. And one of those, a couple of things, balancing hormones. Okay, we can balance our hormones using different herbs, and we're going to talk about those in a second. We also need to correct our menstrual cycle. So those of y'all who know me know that I'm a huge practitioner of vaginal steaming, and that's actually what I'm going to be talking about in depth tomorrow. But just on the quick and easy, correcting the menstruation has a lot to do with the ability to successfully conceive, carry, and labor. Okay, because there are certain things that happen that causes our uterus to be weak, or causes our uterus to be tilted, or causes our uterus to just not be able to carry the baby to full term. Okay, so let's look at some herbs. Red clover. This one is actually a weed. First of all, most of the ones I'm about to name are weeds to begin with, okay? And if you, today, for those who are in the South, it's a beautiful day right now. It's not really raining too much. I challenge you guys to go outside at some point between now and next weekend and look at the ground. Just look at the weeds that are growing. This particular leaf pattern, we've all seen it. That's red clover, okay? Red clover is phenomenal. It's an alterative, the antispasmodic, anticoagulant, anti-inflammatory. It's a lymphatic herb. It's high in vitamin E, calcium, magnesium, trace minerals, flavonoids, salicylics, cyanogenic glycosides. And so literally what all that is that I just said is your prenatal vitamin. That's the easiest way to say it. It's your prenatal vitamin. And what it's good for, because so the herbal action of it, again, the antispasmodic, alteratives, anticoagulants. So what that's saying is that it's going to be a blood mover. It's going to be anti-tumor, so it's going to start breaking down any type of blood tumors or soft cell tumors that you may have in your body. It's anti-inflammatory. Everything that we eat pretty much is inflammation. And a lot of times when our cells are inflamed, it causes pain, it causes water retention. It could cause neurological, and when I say neurological, meaning nervous system type damage. Okay. But overall, red clover is used as a strengthening and toning, and it promotes fertility, relaxes the nervous system, and balances and restores hormonal functions, as well as making or leveling out the acidic versus alkaline levels in the womb. Because if our womb is too acidic, nothing grows. Okay. Dong Quai. Dong Quai is known as a Chinese medicine or a Chinese herb. It's not one that kind of grows up here along the Appalachian. It's one of the ones that kind of grows more out west, and actually the Northwest, like Seattle, Dakotas, stuff like that. But we use the root. It's an emmenagogue. It's a uterine tonic. It helps to regulate hormones. Diaphoretic, which means it helps you sweat. You know, those of us down here in Atlanta, we know we don't have trouble sweating, especially in the next month or so. But either way, it helps to pull off excess water. When you see anything that has the herbal action saying that it's a uterine tonic, understand that this is a herb that needs to be taken long term. Okay, and what it does is that it tonifies, it regulates the menstrual pattern, unblocks the bowels, improves the sex drive, It helps with the intestines so that you have better movement through your intestines, alleviates pains, helps get rid of pus, swelling, and all that good stuff. So when I use Dong Quai, I always use it in a preconception mode. Yes, it can be used in other situations, but specifically I use it in this manner. Another one, Chase Tree, my all-time favorite. I love this, love this plant. We use the berries and we can also use the root. It's a minagogue, a uterine, it's it's a hormone modulator. That's what I'm trying to say. It's a hormone modulator and pituitary adjustment adjuvant. So literally what chasteberry does, it helps to regulate hormones. So think of it as, prime example. You know how we have our menstrual cycle sometimes, and prior to our menses actually coming, we can be hyper emotional, hypersexual, hyper irritable, hyper depressed, you know, all these different emotions and things. And sometimes that can have a very bad reaction because there's actually some menstrual cycle issues that can cause a woman to be so out of flux with her hormones that she could, you know, have intrusive thoughts or even try to kill herself or kill others. And the thing about chasteberry is that it helps level all that out. Okay. It's used to treat insufficient lactation, is used for PCOS, is used for heavy bleeding, because again, it is a hormone-based situation. Ashwagandha, another all-time favorite of mine. It is what's considered an adaptogen. And really what an adaptogen does is that it literally helps bring anything that's out of balance into balance. It's a pain reliever. It helps protect the heart. It's anti-inflammatory. It's a diuretic, which means it helps pull off excess water and you end up peeing it out. It helps with low back pain, poor memory, leukorrhea, depression, drug and alcohol withdrawal, anxiety. Like there's nothing that ashwagandha isn't good for, okay? And you take this prior to, all right? And that helps, all this stuff helps just bring everything back in alignment so that your hormones are in a good place so that when there is implantation, that is successful. Hold on a minute, I see somebody in chat. I'll go back over there. Go back. All right.
I have a question.
Yes, go ahead.
What is the best form of taking these herbs? Like capsules, liquid, etc.
She said twig.
Teas.
Literally, okay, so for chasteberry, I recommend taking it as a tincture.
A tincture, which is?
Tincture, yeah. So when a tincture is when you have anything that's a plant matter that's been extracted by either alcohol, water, glycerin, apple cider vinegar, or whatever. And what happens is you take the plant matter, you put it in a jar, you put your menstruum, which is, you know, your alcohol, water, ACV, whatever you're going to use, and you put it in there and you leave it to sit for 30 to 60 days. And what it does is that that menstruum pulls out the constituents. Okay, so let's say
extract,
yes, an extraction. It extracts it out. So let's say you were going to tincture red clover. Okay, when you put it in the menstruum, after about 30 to 60 days, what's going to happen is you're going to have vitamin E, high levels of vitamin E, calcium, magnesium, trace minerals, flavonoids, isoflavonoids, all those microbiotic enzymes that have now left the plant matter and is now in the actual alcohol or whatever it is you use as your menstruum. Okay. And
Okay.
then you bottle it and you take it like that. So chaseberry is one of the ones that I recommend you take as a tincture, and you take it every day. Like literally, like on my bedside, I have a bottle with like next to my bedside, and every morning I take a dropper full with some water behind it and keep it going. And I take it every day, no matter what.
Okay.
Red clover, you can take it as a tea, you can take it as a capsule, whichever one is better for you to digest. The only thing about taking herbs as a capsule form you have to remember is that it takes a long time for it get to a therapeutic level in your body. Okay, so there's always that you have to think about. Liquid gets into your bloodstream faster than solid because you're going to lose half of it in the digestion process to begin with. Okay, so let's say you're taking red clover as a capsule. You're going to have to take it not 3 to 4 times, like maybe two capsules 3 times a day. You know what I'm saying? And a lot of us already have an issue taking birth control pills once a day.
Right.
So if you got to be responsible for taking all these pills 3 to 4 times a day, every day, you're going to get over, you're going to be done with it really quickly. But that may be, you may choose to do that. So you can do it like that, or you can do it as a tea. Sister Jasmine, is it Jay? Yeah, Jay, sorry. She was asking about whether or not you can put it in foods or smoothies. By all means, yes, you can. Red clover, you can add to food. Dong Quai, not so much. It is super extra bitter. So you really can only take that as a tea or as a tincture form. You can take it as a capsule, but the amount that you'd have to take every day is pretty large. And see, Taylor asked about whether or not to stop taking these after conception. Yes.
Yeah, okay. I was talking specifically about ashwagandha.
Yeah. Ashwagandha and Dong Quai are 2 that you would stop once pregnancy has been confirmed. Okay.
But not the not the chaseberry.
Here's the thing about chaseberry. It's a hormone modulator. Pregnancy is a hormonal whirlwind to begin with. And the thing about it is you really want your hormones to kind of be out of flux because it's the hormones that keep you pregnant. Do you know what I'm saying? Like, it's the high levels of progesterone that keep you pregnant. It's the high amount of estrogens that causes the baby to be released. It's the high levels of estrogen to get your milk to come in and things of that nature. So even though chaseberry is not contraindicated in pregnancy, I don't think it's worth it.
Okay.
The main thing is you want your hormones to be aligned so that you can get pregnant and go through all the things necessary while you're pregnant, because you need those hormones to be high and low and kind of swimming around so that you can maintain the pregnancy and the baby can get everything that the baby needs.
What about postpartum? Like,
Yeah.
would it be just pick them back up afterwards? Like, I loved ashwagandha and I had to give it up when I conceived, and it's like,
Yeah, it's one of the ones you pick up ashwagandha 8 months after 8 months postpartum.
Okay.
And that's because you want your milk. Remember, when you're nursing, whatever you take, the baby takes.
Right.
And it's not necessarily the best thing for the baby at that moment because your mature milk hasn't come in at, right after birth. So I suggest like 8 months, because usually around 8 months, your milk is established, your milk production is established. And at 8 months, usually we're starting to introduce other things, maybe some carrots or whatever. So, okay, sorry about that, y'all. So yeah, I would pick it up after that. Did I answer your question, Taylor?
Yes, thank you. Yeah,
Okay.
for sure.
Revelry, what's the dose in Revelry, which herb are you talking about? You're asking about tincture form, 0.5 ml to 1 ml. Which herb are you talking about, love?
Just any of them actually. The chash tree and the red clover mainly.
Okay. Red clover. So red clover, if you're going to do it tincture form, you're going to want to do like 1/4 teaspoon every day. If you're doing it in tincture form, if you're doing it as a tea, maybe 2 cups a day, 1 to 2 cups a day, just kind of depending on, you know, what your day looks like or what you're trying to do. If you're doing it just to tone and get ready, you only really need to just, you know, once a day. And you can add that with red raspberry leaf tea as well. Chaseberry is 0.5 mLs. And I believe 0.5 mLs is equivalent to like 10 drops if you're doing it in a dropper form.
Okay.
And that's once a day, every morning, preferably when you first wake up. Dong Quai, that is, like I said, a super bitter tea. If you're doing it in tea form, again, it's better to get the actual bark, the Dong Quai root itself, and do it, I find, as opposed to getting it like in a tea, like a shredded powdered tea form. And you would take 1 piece of bark, like it comes in slices.
Okay.
So it'll be 1 bark slice per cup once a day or twice a day. Okay.
All right. Thank you. I appreciate it.
No problem. Joy, she asked which one would I recommend, which herb would I recommend for getting hormones back balanced? Definitely chaseberry. Definitely chaseberry first.
So chaseberry would be your first go-to?
Mm-hmm.
Okay.
That's my first go-to for any hormone imbalance. That's my first one to go to. But then also too, you know, you got to look at what's causing your hormones to be out of balance. Is it because you're on birth control? Is it because you have a Mirena IUD, or not a Mirena, but just any IUD? Are you eating a lot of foods that have been manipulated by hormones, such as beef and chicken? You know, are you eating a lot of animal milk products? You know, things like that. Did I answer your question, Joy?
You did. Thank you.
Okay, no problem. All right, so, huh?
Oh, I'm sorry. I was just wondering, so you wouldn't take those herbs that you listed before, you wouldn't do all of those, right? You would like pick 1 or 2?
Yeah, just pick 1 or 2. You don't gotta do all of them. But it's just different ones. Because some, you know, again, the thing about herbs is that, you know, you don't know what you're allergic to until you take it, especially if you've never had it before. So you may not, you know, you may have a reaction to red clover and not know that you're allergic to it. You know what I'm saying? So these are just different things to look at when you're taking herbs. And then let's say you decide you want to try getting your body ready for fertility, and you pick up a multi herbal decoction, you know, whether it be like a pill form or a liquid form, and you're looking at the ingredients. It's always good to know what the ingredients are in something so that you know how it works, okay, and what it does. Does that make sense?
Yes. Thank you.
So any more questions about the herbs before I move on to the physical thing that we can do to get our womb ready? No, we're good? All right. So moving on then. So the next best thing is bee steaming. Go crazy. I love bee steaming. The beautiful part about vaginal steaming is that Huh? Did someone say something? Okay. So the way steaming works, it is an old practice. I know there's been a lot of grief about vaginal steaming and where it comes from and how it starts. But again, it's a practice that's been done since the beginning, and it's documented in a lot of ancient texts. It's just not called vaginal steaming. If you look at older texts, it's in texts from around the world, it's going to say fumigation, smoke therapy, um, choyo, bajos, even forms of it is called like moxibustion. So those are the different names that it's gone by. It being called vaginal steaming is new. If you're in the East, it may they still may use the word yoni, because yoni does actually mean vagina. But those are one of the things that I specifically use to help women's womb heal. Because again, remember, our womb collects everything. Okay, we are the universal receivers. Okay, and so the steaming the yoni, it works because the yoni, the pelvis, and the anus are directly accessible to the medicines and the oils as the steam dances over the infuses the tissue. When you have when your womb is when the steam gets to your womb, it increases circulation, it increases lubrication, and it helps for your womb to drop and get rid of all the things that no longer serves it, whether it be mucus, old boyfriends, old girlfriends, scar tissue, anything like that. It's beautiful for that, and it does help. Okay, so don't let nobody tell you it doesn't help. Now, when we start to do all of this, now mind you, we're still talking about preconception. One of the things that we have to remember when we have our sister circles, we're talking to our girlfriends, our sisters, or whatever, is that it takes a minute. It takes time. This is not an overnight fix. It was not overnight that our womb became congested or became toxic or just became barren. It didn't happen overnight. So neither is coming back full circle and correcting those imbalances going to be overnight. And we're going to go through some processes. So let's hold space for our sisters so they can release, accept, forgive, and move past the traumas that have once held us hostage. Okay. Let's see. All right. Phenomenal. Yes, yes, yes. Steam away, steam away. Any questions before I move on to the next part?
Yes, I do. So would you do a combination if the issue is the thickness of the uterine lining? Do a combination of steaming and some type of herb?
Yes.
Okay, is there a common herb that's used for uterine lining?
Well, okay, so for the uterine lining, you're really going to want to steam because you're going from thick to thin. Hold on, let me see if I can stop this real quick. There. Okay. So what it does, it goes from you're going from a very thick uterine lining to a very thin uterine lining. Okay. And the thing about the uterine lining being thick is that it's usually associated with heavy menstrual cycles, stagnated blood, things of that nature. Okay. So when you steam, it's going to help loosen up those layers that are not real layers. Does that make sense? So when you do have your menses is going to be a little heavy for the first menses or two. And then you'll realize that, oh, wait a minute, it's a little lighter now. Oh, it doesn't last 7 days or 8 days. Oh, I don't feel like killing everybody right now. So to get the uterine lining to go from thick to thin is a physical thing that needs to be done. Now, in the process of releasing that endometrial lining, you want to have something to help balance out all those hormones. Because the one thing that I don't think a lot of people understand is that our hormones are released from our hippocampus in our brain as well as our ovaries. That's where our hormones come from. Okay. So if your womb has been congested all this time, for whatever reason, your ovaries are putting out the wrong amounts of hormones to help maintain homeostasis. Okay. Your body is an organism outside of conceptual thought. So it's going to do what it needs to do to heal itself and to correct itself. But if there's something stopping it, it's going to throw you all off whack. So yes, definitely do something physical and do something internal, because you want to make sure you attack it on both sides.
So you went from the direction from thick to thin, but if the issue is that it's too thin and it needs to be thickened, I think that was specifically what I've seen.
Mm-hmm.
So I don't know if that's a help that steaming can provide, or is that more of an herbal?
When it's already thin,
Yes.
it's usually going to be a case of some type of tissue atrophy or lack of circulation or something like that. So that's where that thinning process comes from. Either there's poor circulation, poor oxygen, low lubrication, something in that area. Steaming will increase lubrication and it'll increase the circulation to that area. So that will make the tissue itself healthier. Does that make sense?
It does.
Okay. Yeah, okay. Any other questions before we move on to actually getting pregnant? Going once, going twice?
How often should we be vag steaming?
Every day. No, there's actually a protocol for vaginal steaming. For purposes of the question that's being asked right now, I'm going to just legitimately say you want to steam before menses and after menses. But I get into that really in depth tomorrow. So if you're able to log on tomorrow, definitely log on, and I'll go over all that in a lot of detail. But primarily, you want to make sure you steam a couple of days before your menses and a couple of days after your menses. Okay. And that's going to have a lot to do with it. And you just do that consecutively. Over time, you will realize that your womb feels lighter, your heart, your mind, your spirit feels lighter. And what's funny is that when you start steaming and not just steaming, mind you, I'm just going to say just overall, when you start detoxing your body, regardless if it's a whole body detox or just a womb detox, baby, let me tell you what you look like. You look like a plate of ribs to hungry dogs, okay? Your skin is glistening and glowing. You feeling good about yourself. Your aura is popping. You looking like gold. Everybody in the world is going to see you and they're going to be like, oh, what you doing? Oh, you look good today. Oh, excuse me, ma'am, how you doing? Next thing you know, girl, it's like a moth to a flame. It happens every time. So just imagine if, for young ladies that have said, they say they've been in a drought, so to speak, you start detoxing your body, detoxing your womb, and getting your spirit together, you'll be beating them off with a bat. Promise you. Did I answer your question, sis? I'm sorry, I kind of got off on a tangent.
Yes, you did. Thank you.
Sorry.
Is there a sort of general preconception steam herb combination that recommended? I mean, I know each person has specific things, but sort of the baseline preconception herbal combination.
It really just depends on what's going on with the womb, to be honest with you. If there's a lot of stagnation, if there's a lot of mucus, if there's just a lot of congestion, like all that looks different and has to be taken care of a little differently. Okay. So, yeah, it has to be taken care of a little bit different. So there's no one specific blend or one
Right.
specific herbal situation. It's more about how often you do it.
Right, but in terms of a person that may not have any particular conditions, they just want to prepare. And
Trust me, everybody has something.
okay,
Even it's funny, even though people think they don't have something, we all have something. Now, it may not be as extreme as like endometriosis and PCOS. It may be just the fact that when we have our menstrual cycle, we have a couple of clots and we feel like killing everybody and want to eat chocolate all at the same time. That unto itself is a situation. You know what I'm saying? So it's just a matter of extreme. Is it super, super, super extreme, or is it kind of just easy?
Gotcha.
Okay. But even still, even in being easy per se, it can cause a lot of challenges getting pregnant. You know, you have a different chemical makeup. I have a different chemical makeup. Joy has a different chemical makeup. So that little thing could be the one thing stopping us from living our best life. You know what I'm saying? So that's why I say it just kind of depends on what's going on with the womb to begin with, what's causing it. And this goes for the men too. You know, they have to always blame us for not being able to get pregnant. No, baby. Sometimes it's the men too. Like I had to work with a young man who had poor sperm motility, you know, and the wife was good. She was great. All her eggs were good, her levels were good, but his sperm was just, they were weak. They just wasn't going nowhere, swimming in circles, you know, and I had to detox him because he had a whole bunch of stuff going on. And I put him on an herbal regimen, and literally 3 to 4 months later, he developed what I affectionately call angry sperm, and that angry sperm got her pregnant. So they're out there living their best life now as parents, having their 2-year-old destroy their house. So,
so you offer assessments?
Huh?
Do you offer assessments for?
Yes.
Okay.
Yeah. For fertility, and for those of you who are also herbalists or want to incorporate herbs into your practice, this is always a conversation piece. Do not, and I'm telling you this from trials, tribulations, and trauma. Do not ever just have a blatant discussion because someone slid into your DMs asking questions. No, they need to have a conversation with you because it's never just a one thing. Like it's a varying onion of layers that you got to kind of get through. Because sometimes it's literally just as simple as them changing their diet. It could be as intense as them changing their mindset. You know what I'm saying? So fertility stuff is always a conversation piece, and you have to follow that up and keep in contact with them, because when you're doing herbal fertility regimens, it can get very daunting and it can get annoying and you'll get frustrated, you get pissed off at the world, and then you got to recollect yourself and come back. Okay. Did I answer your question, sis?
Yes, thank you.
Any other questions before I move on to the actual fun part of pregnancy? Okay, so moving on to pregnancy. So we have worked on our womb. We've got our menstruation cycle right. Our mate has their stuff together. We are ready to conceive. We have angry sperm. We do our thing. We have our sacred sex rituals, or whatever we want to do to get pregnant. Boom, we're pregnant. Now that we're pregnant, Western medicine tells us we can't have a single freaking thing. But yet I'm 8 weeks pregnant and I'm having nausea, vomiting, I got cramps, I have headaches, I don't know if I'm coming or going, I'm sleeping all day. There's nothing that can be done according to Western medicine. Now they will give you Zofran. They'll tell you can take Tylenol, but oh, that's pretty much it. And there's a reason for that. And that reason really bakes down to the fact that allopathic medicine has a lot of stuff in it. Okay, it's not just one thing. There's a lot of chemicals in it that are used, to make you addicted, or it'll fix one thing, but then it messes up everything else. So, prime example, have y'all ever seen the infomercials that are like, "Ooh, we have this new drug and it's going to cure this," and then you listen 3 minutes later in very low terms, very fast, it says, "Okay, you take this medicine, it's going to cause anal leakage, it's going to cause headaches, it's going to heart attack, it's going to cause you to die, you're going to grow a third arm." Like, yes, it helped my bloating, but in the bloating, I'm about to lose my liver, my kidney, and my third toe. Like, what? Whatever, right? So that's why they say allopathic medicine is not a good idea for pregnancy, because it has too many effects. And then there are some medications that actually have what they call a tetragenic effect, which means that it will change the development of the baby, of the fetus. It can cause cardiac development issues. It can cause brain abnormalities in the baby. It can cause the baby to just be born grossly deformed. So that's why plant medicine comes into effect, because the side effects are not the same. And when it's used correctly, you just don't have those kind of problems. Like, do you know how hard it is to have a side effect to dandelion? Like, you have to sit there and eat, like, get like the big collard green pot of dandelion and eat that like 4 or 5 times a day to have a side effect. You know what I'm saying? Like, the only side effect you're going to have from taking a bunch of herbs is that you're tired of taking the herbs. You know what I'm saying? Like, you're not going to grow a third toe. Your heart, you're not going to have a heart attack. You're not going to have a stroke. Those things just don't happen when you do herbs. So let's look at some herbs that are typically used during pregnancy. I swear I got to learn how to use this better. Y'all pray for me. All right. Okay, so during pregnancy, it's imperative that both mom and baby have the best nutrition as possible. The typical American diet lacks all the good nutrients, essential nutrients needed to maintain a healthy pregnancy. Remember, you have a baby growing inside of you. So whatever nutrients, macronutrients that you have or have on reserve, your baby's going to take it for growth. Okay. So red raspberry leaf. There was a young lady that spoke about it. Very, very good, very high in vitamins and minerals. Helps tones. Okay, so also too, real quick, this one is kind of controversial. Some people say that you shouldn't take it because of the relaxation. Some say you should take it because it helps with toning. This herb is one of the ones that works on both sides of it. It just depends on what's going on at that particular moment. Okay, so prior to labor contractions, it's going to help tone and hold the baby in. Whereas when you're taking it on the other side, when you're closer to labor and going into birth, it's going to actually relax the uterus a little bit. Okay. But prior to that, prior to labor, it's a nutritive. It has tons of vitamin C, A, calcium, iron, tannins, phosphorus, like all the minerals and stuff that we usually don't have, or we lose a lot of it because we are pregnant. It also helps with nausea, upset stomach, can also reduce pain, like I said, during labor and after birth. The dosage for that, if you're doing an infusion, 3 a day, 3 cups a day, which is equal to 4 to 8 grams. If you're doing dry capsules, 4 to 8 grams as a tea 3 times a day if you're doing capsule, and then 4 to 8 mLs 3 times a day if you're doing a tincture. Stinging nettle, you cannot go wrong with nettle. And you can actually take nettle in preconception. Nettle is good for everything at all times, no matter what, okay? And you can take it as a tea, you can take it as a capsule, but it works better as a tea or food, okay? It's a liver kidney tonic, so it helps with liver and kidney. And what we have found out in a traditional midwifery sense is that when you have a sluggish liver, that correlates to having a slow or sluggish digestion, which correlates to having a slow or sluggish labor pattern. So for those of us who are current birth workers, have you ever had a woman or a mom who had been in like early labor for 20 something hours? It's just like she just will not progress. I guarantee you, if you go back and look at her diet, look at her history, she's had symptoms of like a sluggish digestion and or sluggish liver processes. Stinging nettle is also an astringent, which means it tightens. Diuretic means it pulls off water. Hemostatic means that it's going to work to cleanse the blood. Okay. But it increases fertility. Like I said, it's nourishing. It's super, super extra nourishing. And I've actually given this in combination with ginger for my moms who's had the first trimester nausea. I would tell them take stinging nettle and ginger tea to kind of help get past it, and it usually works. And then also too, you can eat it in a salad too. One of the things, before I move on, one of the things I'm a big proponent of is during pregnancy is to have food as medicine, okay? Slide it in, get them to eat the turmeric, have them eat, the nettles, have them eat callaloo, okay? Callaloo is high in vitamins and minerals. And for your, the Caribbean background, who are not Caribbean, callaloo is a green, it's like a spinach almost, but it's a weed at the same time. All right, so Irish moss. This one is highly controversial. Out of all the plants that I'm gonna talk about today, this is the main one where there's not a lot of information on. And if you put it in Google right now, it'll tell you not to take it because it does, doesn't interrupt, but it kind of will have an effect on your thyroid and because of the iodine levels. But here's the thing about Irish moss. Irish moss or any of your seaweeds it's the only plant in the entire plant kingdom that has the highest concentration of vitamins and minerals, period. Hands down across the board, okay? It is safe to take during pregnancy. Whether or not you can take it is a different situation because if you're not used to taking seaweed or eating seaweed, taking it while you're pregnant could be a little bit interesting moment because it tastes like fish, okay? To be honest with you, it tastes like fish. Like I can't take it as a seaweed. Whenever I've had to do it, I've always had to do it where I dried it and powdered it and encapsulated it because I just couldn't do it. But it's super, super good. It's high in everything, and it's the whole plant. The decoction is made by steeping 1 to 2 ounces in cold water from either 15 minutes to a couple of hours, and then you can mix it with water, milk, or whatever your choice of drink is.
If you're taking the gel, how much do you recommend taking a day?
In the gel form, you can take a tablespoon to 2 tablespoons. But like I said, it's one of those herbs that when you do take it, like if you're not, like honestly, if you're not used to eating sushi or seafood or anything like that, it's gonna cause you to like, oh, ooh. You're gonna make an ugly face. You know? So definitely, if you're, like I said, if you're not used to it, mix it with something. Mix it into your smoothies or anything like that. And yes, Dr. Jawan Martin, she's on, and she was saying that when it's boiled in a beverage, it's great. Typically in the Caribbean, women drink it, but make sure to soak it first, rinse, and then proceed to boil with spices. And that's the truth. Most of the women in the Caribbean eat this every day, all day. Like it's no big thing. Just how like you have your Italians that drink wine during pregnancy. You know, their body, their DNA, their genetics are used to it. So that's why I say it's controversial, only because there's not a lot of information out there about it. And the first thing that you're going to find is the disruption that it has is with the thyroid. Nasi asks, can you take it postpartum? Absolutely. Let's see. Okay. River Rock, yeah, Lion said you gel it. Yep. CMOS, yep. Exactly.
Does the color matter?
Huh?
Does the color matter? Because I heard the red one or the deeper color is more nutritious than the clear colored one.
So all of them in general are good for you, but yes, as with anything, you have a higher concentration of certain certain minerals in certain colors. So I believe, if I remember right, the purple one has a higher concentration of calcium. The greener one has a higher concentration of like phosphorus and something else. Vitamin C and maybe magnesium. And then the red one has a higher concentration of potassium. Like they all have a higher concentration of some type of vitamin because of where it comes from. But overall, Irish moss is good for you. Yeah, I believe the purple one comes from a little further east. I know like the red, green, and white one come down from the Caribbean, but I think the purple one comes from on the other side of the world, not in our triangle Western Hemisphere side. Let's see. Any other questions before I go on? Okay. All right, so that's Irish sea moss. Okay, now we're in pregnancy. Now we're moving towards the end of our pregnancy, going into labor. Okay, so we have blue cohosh. Sorry, blue cohosh is contraindicated during pregnancy until you were like stalled in labor 40, 41, 42 weeks. I usually have, not usually, I've used this in combination with black cohosh as well to help stimulate contractions. And that's what it is. It's a spasmodic. And that's what it helps to do, is to, when you take it during a stalled labor or a soft contraction, it kind of helps pick it up and makes the contractions a little harder. The only thing is that you have to do it, you have to take it like every 10 to 15 minutes for about an hour to keep it going. And this is definitely not something that you want to just do because you heard it here. Like I highly suggest every herb that I talk about, if you want to bring them into your practice, look it up, research it, get to know it, like know it intimately. Because you know, you don't want to take a chance of doing something at the wrong time and having a wrong effect. Evening primrose. Okay, so I use evening primrose oil at the end of a pregnancy. Again, the herbs that I'm talking about now are going to be ones that we see towards the end of pregnancy. And actually what I do is I have women use this in the oil form, like the little capsules that you can get from Walmart or whatever. And I actually have them use it as a suppository. And it's going to help with softening the cervix. It's going to help with softening the cervix, any bacterial, any antimicrobial situations that could be in the uterine canal. It's going to help with that. And then it has prostaglandins in it. So, you know, have you, I'm pretty sure all of y'all have heard that when you're pregnant, towards the end, if you want to go into labor, go ahead and have sex and make sure that your mate ejaculates inside of you. That's because of the prostaglandins that's in the sperm, because it helps trigger labor. Cramp bark. Cramp bark is one that you can use during your menstrual cycle to help with the cramps, because it is a smooth muscle relaxant. In a pregnancy setting, it's done again at the end during labor. It will help ease off some of the contraction pains. It doesn't stop the contraction discomfort, but it'll kind of take it off take an edge off a little bit. And then once the baby's born, those postpartum contractions, cramp bark I use cramp bark there as well, and it works really, really well in a postpartum setting. Lemon balm. Lemon balm is very much calming, and it helps with the depressive. It's an antidepressant, it's antimicrobial, it's a relaxant, it's all those good things. So towards the end, when mom's kind of like getting into her head about things and she's like, oh my God, and she can't get around it and whatnot, you can actually give this to her. So like when she's drinking coconut water during like those long labors, you can give her some of the lemon balm, and that's going to help her mental state of mind kind of come down a little bit and allow her to kind of get on the other side sometimes of whatever the fear is or whatever the discomfort is. And then you can take lemon balm, you know, prior to pregnancy. I haven't seen any information about taking it during pregnancy, mainly because of the spasmodic. It has like a very soft spasmodic nature. I haven't seen any information about it, but definitely one of the ones you want to look up if you're trying to give it during pregnancy, but definitely before and after, no problem. All right, so I love this little image right here. The man is asking, does she need anything? And the mom is saying no, but in the back of her mind, she's saying, I need a home-cooked meal, a shower, a break, time for myself, sleep, someone understands how bad I feel, rest, help, hug, support, cookies, quiet, nourishment, someone to do laundry, cooking, everything. That is all of us. We don't talk about what we need. We just think everybody's supposed to know what we need, but we have to find our voice. We have to get to a place where we can say, hey, I need these things, okay? So let's look at postpartum, okay? Because that's what we're entering into now. Oh, before I go, was there any questions about any of the herbs during pregnancy?
Yes.
Yes.
So I assisted a birth last year, October.
Mm-hmm.
And while in the hospital, while she was in labor, they said that she couldn't drink or eat anything because that would affect the baby in some way. And I was wondering, since like you have herbs like cramp bark and the lemon herb, how would they take that during that time?
Okay, so you have to understand something about what the hospitals are actually doing when they say they can't drink or eat. When you cannot drink and eat in the hospital, what they're doing is setting you up for an epidural. So an epidural is an anesthesia, and anything on your stomach interferes with the absorption of an epidural. And if there's a possibility that you have to have a C-section, you're going to go under anesthesia as well. Sometimes, depending on the situation, it may be a full, like a full anesthesia, or it could just be a local, or like a nerve block. And those medications that they use for that is contraindicated to have anything on your stomach.
Okay.
So that's why they say don't eat, don't drink. But if you're in a place where you know, you're able to have a low intervention birth, or you're determined, I am not going to have an epidural, or you're doing a home birth or whatever, all that stuff can be made into a tea, and you just sip the tea. Because when you're in those last couple of moments of labor, when that baby's like right there or whatever, you're not going to want to eat anything at all. So all this stuff is liquid, and it's a matter of just sipping it. You know, give her a straw, like, hey, you haven't had anything to drink. You know, in pregnancy, in labor, you have to stay hydrated. So if you make this tea ahead of time, like, hey, drink some of this, drink some of that, drink some of that. You know, we sometimes we'll even give moms honey sticks, you know, and you can do lemon balm infused honey. You know, you just have to prepare it, you know, prior to, and just have it in your bag.
Okay.
Okay.
Okay. So only when there's no C-sections happening or epidurals happening, basically.
The politically correct answer is yes.
Okay.
Okay, I'm gonna leave it there. It's a politically correct answer. I can tell you that when you use cramp bark is giving as a tincture. So it's like a couple of drops under the tongue, and it works really effectively and right away. So that's not so much of an issue as much as a tea or something like that. Does that answer your question?
Yes. Yeah.
And then I see M. White. She's asking about herbal ice cubes. Definitely, you can definitely do that. Just please don't do weed infused ice cubes. Don't do that. See, Joy, you know what? I'm gonna do an IG live about this, about marijuana and pregnancy, because there's a whole thing about that, and that's a whole tangent, and it's not. You talking about plant? We're not talking about that plant. But I'm gonna talk about that on IG live tomorrow.
Yeah, because people are running around infusing it into everything, including not telling people.
And there are pros and cons to it, but I'm not gonna take the time here to talk about that one. But I will definitely do that. Yeah, and yeah. I'm okay with you asking. Got to know these things. How far in advance can you make the teas for mom? So I've made teas up to a couple of days. So let's say the due date was today. I'll make a tea. What day? Today is Saturday. I'll probably make it like on Wednesday, and then just keep it in the refrigerator. You know, have it in your little bottle, make it in the refrigerator. Or if it's a situation where y'all decided that you're going to come when she's in like an earlier stage, you can actually make it at the house. Just have the tea, the herbs already together and put together. You can make it at the house. It just kind of depends on how you're moving. You know what I'm saying? Like if y'all agree for you to show up only during active labor, it may be a little more cumbersome, but if you've decided that you're going to show up in the beginning parts, you can make it while you're there and give it some. Let's see, anything else? So Mika asks, can you make infused oils with the herbs? Yes, you absolutely can. You absolutely can, but they don't really have an effect topically during this time frame. During this time frame, because of what the body's going through, you're going to want something internal. Okay, so that's why the cramp bark and the lemon balm and the black and blue cohosh. Doing it externally is not going to really do too much. Okay, let me see. Oh, no problem, Mika. One sister is talking about mommy showers. Yes, you can pack all these up and it can be part of the mom with the blessing way, or even sometimes you can, like if they're doing showers for the labor, you can put like eucalyptus in your, like some of these, like the lemon balm is volatile, has volatile oils in it. So it's one of the ones that you can put in a, do for aromatherapy, you know, your sweet orange, your clear sage. Those are different things that you can use as well to help with the progression of labor. Okay, so moving on to postpartum. And then postpartum, I'm talking about the baby's born, okay? So dandelion root. For those of us who have assisted with births in the hospital, you know that one of the things they always get is a bag of fluid. And the reason why they get a bag of fluid, again, A, is because of hydration. You have to stay hydrated, because if you don't stay hydrated, you can end up with a situation called a dry birth. It hurts like hell. It is the worst feeling in the actual world. And that's also part of where the ring of fire comes from that everybody talks about. In a home situation, a home birth situation, or at least a low intervention birth situation, you're going to be constantly sipping on water, coconut water, vitamin water, juices, you know, whatever. But what ends up happening in a hospital setting, there's a lot of fluid retention that happens because the mom is not allowed to get up and walk around and move around. So she ends up being discharged, and now her ankles are like, they're huge. She has tankles now, or she has swelling in her hands, swelling in her knees, stuff like that. All that's not a good thing. None of that's good. And the higher the swelling, the worse the situation can become. But dandelion, the whole thing, first of all, it's a nutritive, A, but then it's a diuretic, and it's a soft diuretic, so it doesn't pull potassium out of the body. So usually I give my moms afterwards, the automatic thing they're going to get dandelion, and that's to help pull all the extra water that's been trapped in their body out. Now, when you use dandelion, it's not a thing of where they're going to be going to the bathroom every 5 minutes. It's just that when they do go to the bathroom, they're going to be there for a long time. So it's a lot of fluid pull out during those moments. Some of the problems that happen in postpartum is postpartum hemorrhaging. And as a midwife, I use a combination of 3 herbs: shepherd's curse, yarrow, and lady's mantle combined. All of these combined. And these herbs specifically are used to stop bleeding, okay? They're called styptics. Styptic herbs are words that actually stop bleeding. I use all 3 of these together, and I use them as a tincture form. Now, I've also used those 3 herbs for women that have super heavy menstruation, or they end up having a surgical loss or a miscarriage or something like that, and their bleeding lasts way, way, way long. I'll give them that as well to help stop the bleeding. And so again, ladies' mantle for heavy menstrual periods, and again, as well for postpartum hemorrhaging. Hold on real quick, let me check the chat. What's going on in the chat? Okay. Okay. So Taylor, you were asking what's the shelf life of dandelion tincture? If any tincture that's done in alcohol is good for life. If you do it in apple cider vinegar, I believe it's 3 to 4 years. If you do it in glycerin, I think it's, glycerin is kind of funny because it's a sugar compound. So I think if you have a pure glycerin, it has to be refrigerated. If you do it in water, it's only good for like a week or 2. But the herbs that I just suggested, I don't suggest tincturing them in water, only because you want them to be used right away. Now, if you want to give it as a tea, that's something totally different. But tincturing, you really want to do that in alcohol. Fatigue, yep. Yes. Is there a vegan alcohol? Technically, Pam, all alcohol is vegan, because it's going to either come from a potato, or it's going to come from barley or wheat, or it's going to come from a root, or it's going to come from a guave. So technically, all alcohol is vegan. Oh, okay, yeah. Any particular tincture brand? Mine. But no, there's a couple of good places out there. 5 flavor herbs, they're really good. That's all I can think of right now is 5 flavor herbs. They have some. Women Wise has some good ones. That's all I can think of right now. Rich. Some of the fermented alcohol is not vegan. True. But I don't. At the second, I can't think of anything that isn't technically vegan. I'm sorry. All right. Let me move on real quick because my time is going to be up in a second. Well, not in a second, but I want to make sure we get through the postpartum part. Okay, so blessed thistle. Blessed thistle is one of the herbs that we use for, it's a cholagogue, it's a galactagogue. So the cholagogue is going to act as a digestive aid. The galactagogue is for breast milk. So blessed thistle, milk thistle, either one of those, both of those actually can be used to help proliferate breast milk. Okay, and it's the prolactin in it that helps it. So the postpartum, and I got some more herbs coming up too, sorry. The postpartum period begins immediately after birth of a child, and actually what we consider postpartum is birth of a child up into 1 year. And it can be divided into different phases. The initial and acute phase, 6 to 12 hours. The postpartum, subacute postpartum is 2 to 6 weeks, and then delayed postpartum is anywhere 6 months to a year. And it's usually during that subacute to delayed part is where we have a lot of the problems coming in with postpartum hemorrhaging, postpartum pulmonary embolism, postpartum swelling, postpartum eclampsia, postpartum depression, all that stuff. That's where a lot of this stuff comes in at. So with my birth workers, or even my people who are dedicated to being postpartum, this is where your work comes in, because you're assessing what's going on. You know, is there bonding? Is mom nursing well? Is she still bleeding 2 months later? Is she having cramping? Did her C-section not heal correctly? Those are things that we're looking at. Now, when we get into like that whole baby blues situation, okay, so I know it's always said that you don't drink alcohol during pregnancy or after pregnancy, but here's the thing. Hops, which is in beer, not only does it calm your mama down, because she probably wanted to drink for a whole, 10, 11 months already, but what it does is that it pulls her anxiety down, and it is so much of a nervine or a sedative that it allows her milk to come in. Not come in, that's not the right word. It allows her milk to flow a little bit better, because as y'all know, your mental state of mind or your emotional state of mind during this time will affect whether or not you are successful at nursing or not. So one of the things that I always tell my moms afterwards, I'm like, hey, guess what? Y'all guys can drink beer now. Have fun, go crazy. They cannot have a keg, okay? They can't have the big 64 ounce, but they can have like a regular 16 ounce thing of beer, maybe once a week, maybe once every 2 weeks, or if they get really, really stressed. It's not gonna hurt them or the baby. For those who do not drink at all and don't even want to take any parts of it, oatmeal, milky oats, super good nervine. It's an antioxidant. It has a lot of nutritional value, has a lot of zinc, calcium, silicone, vitamin A, B, iron, manganese. It has all that kind of good stuff. That's really good as well to help with moms who are over anxious and kind of are starting to wean back and forth from that baby blues to depression and whatnot. And again, this can be given as a tincture, or you can just have them eat oatmeal, because oatmeal and milky oats are one and the same. Fennel. Fennel is used to not increase, but it's used to improve the milk or milk flow. It also has a energetic notion of regulating the stomach and abdominal pain and increasing ingestion, and it also increases appetite. So one of the things that happens after birth is that moms forget to eat. Like literally, they're just like, oh, wait a minute, it's 3 days and I haven't eaten nothing. So you can give them fennel tea or even include this into the food. One of the things that I do is for the 4th trimester or postpartum, I always make my moms a soup using fennel. And it tastes pretty good. It's not that bad. Fenugreek, we all know that fenugreek has a direct result on the breast milk. It's a galactagogue as well. It's an anti-diabetic, anti-inflammatory, oxytocic, diuretic. It's an appetite stimulated. It's good for gastritis. For moms who are having trouble with milk production, they could take this and it will help bring in or stimulate their body to produce more milk. Now, remember, when it comes to nursing, they cannot just do herbs alone. They actually have to work on the latch. You know, and if there's an issue, you may want to have them check the tongue to make sure there's not a tongue or lip tie on the baby. You want to make sure that they can get milk out of both breasts, because sometimes they may have a collapsed milk duct in one breast and no milk comes out of it because it's collapsed. So, you know, you always want to troubleshoot. Don't just allow your parents, your moms, to just rely on fennel and fenugreek. There's some other stuff that needs to kind of go on as well, just to make sure everything's on the up and up. Passion flower. Okay, so passion flower can actually be given during the 3rd trimester. I don't particularly like to give it in the 3rd trimester because it is a sedative and a hypnotic, and sometimes that can do a couple of different things like dropping the blood pressure. But definitely after birth, they can have passion flower, and usually what it's used for is to help a mom sleep. It helps with hemorrhoids. It helps with postpartum eclampsia, which is the high blood pressure. It can also help with other symptoms of depression, headaches, and whatnot. And literally what you do, you don't actually eat the flower, you eat the leaf. The leaf is what you use, and you make a tea out of it. And it tastes pretty good. Sleep really well too. Wild yam is an antispasmodic. It's used in postpartum, kind of the same way cramp bark is used, but this is more so afterwards. So in postpartum, you know, you have a lot of uterine contractions because the baby is nursing. This is going to come in after that. So if they're still having cramping and whatnot between nursing, or let's say after their C-section, you can use this to help with a lot of that. And it'll help ease out a lot of the spasms that they're having, as well as some of the nausea. Let's see. Aaliyah, yes, they're going to send out all these slides at the end of the talk. I can't pronounce your name, but Galladay, I have no idea what Q&A means. I don't know what that means. Dr. Jawan, yeah, malt, yep, it's because of the hops and the barley that's in that. Fenugreek is good for thyroid issues. What do you make me to do for the education? Joy, oh, thank you, Joy. I'm actually going to be teaching a class the first weekend of June 6th and 7th, on how to make a lot of these herbal preparations. So definitely swing by. As far as books, there's a ton of them. And what I'll do is I will take a picture of my book collection and I will post it up in the Black Doulas Association group, because there's a lot of them. Oh, questions to, oh, okay. Thank you, Ms. Galladay. I did not know that. Brittany asked, isn't it true that galactagogues can also slow milk production? Yes, if taken Okay, so the way the herbal actions work is kind of like how, you know, when you read your ingredients on a label, if the first 3 ingredients are listed, are like glucose, water, and oil, that means over 50% of that particular product has sugar, water, and oil in it. So it's the same thing as the galactagogues, because it's a herbal action. So if you have, so when herbs are listed, they're listed in order of the strongest herbal action. So if the galactagogue is the very first one, that's pretty much what is used. That's pretty much how strong it is. But when it says it's a galactagogue, no, galactagogues don't slow. I'm sorry, no, galactagogues increases. I'm sorry. It's the aminogogues that causes the body to stop producing. Galactagogues are good, aminogogues stop production. So it's the other way around, I'm sorry. But yeah, but what I was saying as far as the order it goes, that's what it's strongest for. Okay, so if you do have a herb that's both a galactagogue and an aminogogue, it really just depends on when you're taking it and what's going on in your body, and it'll do what it needs to do.
Right. I was just asking because I have heard that before, like with fenugreek and stuff, like in trainings that I've done, they like emphasize, like, of course, like you said, like troubleshoot first before going to fenugreek and stuff, but then they were like, be careful because it can also, and I guess maybe the issue is that it just reacts that way in some women.
Yeah.
Okay.
Yeah, and then too, it's one of the ones you don't take it often. You know, like you're only going to take it for a certain amount of time and then stop. And not for any other reason than you just get tired of nursing. You know what I'm saying?
Right.
You get tired of it. I have a question, says herbs for weaning, from Latasha. If we have a mom who is pregnant but still nursing, what would you suggest? If mom is pregnant and she's still nursing, she needs to stop. That's literally just it. Reason why is because the milk that's being, if she's nursing, the milk nutrients for the child that she's nursing is different than the milk nutrients that the newborn baby's going to need. So she's going to have to figure out what she wants to do. She needs to actually wean the other baby off the breast to allow the colostrum to come in correctly for the newborn baby. Does that answer your question, Natasha? All right, Ms. Galladay said, what if she plans on tandem feeding though? Oh yeah, well, that's the thing. At that point, you gotta remember, by the time another baby comes on board, that first baby should be almost a year old. So the milk nutrients are different and you want the newborn baby to have what it needs. The older baby is going to have to start being weaned off, and by then they should be actually being introduced to food and things of that nature. Oh, y'all, I got 3 minutes, but I still had another section. So I am going to just take questions right now. I'm sorry, we ran out of time, guys. I'm so sorry. I can take like 3 more questions and then I'm going to shut it down and make way for Dr. Jawan Martin, who is a pelvic floor therapist. Banging. Like okay, so my youngest kid is like 17 years old. I took one of her pelvic therapy classes and I wanted to do all the physical requirements needed to get my pelvic floor back intact because I didn't realize how jacked up my last pregnancy was. All right, let's see. For Pam, pregnant nursing mom. Yeah, okay, she's talked about that. Requirements. Yeah, Akila, I'll cover it in the master class. Yeah. Amina, how can you treat hemorrhoids when the mother comes home? Steaming or tinctures? You're actually gonna want to steam, and steaming is done in postpartum. But I'll talk about that tomorrow in the steaming class. Let's see. All right, so I got 2 more minutes. Any other questions? And I apologize, guys, we ran out of time, but I will do a masterclass specifically for 4th trimester. We talk about different recipes and food as medicine. My class tomorrow, Zaikisha, is at 2 o'clock, I think it's 2 o'clock. Okay, so my time is up. Thank you guys for being here. Thank you for the questions. Thank you for not making me really nervous, because I was super nervous when we started. Stay tuned, stay online for Dr. Jawan. Jawan Michelle, she, like I said, awesome, one of the baddest therapists in the game, and I appreciate you guys. So, bye.